Hello, everybody, and welcome to our UCSF GERS-sponsored fellowship open house. We're very excited to share a little bit about what we do here. We're very excited for the interview season that's up ahead and getting to meet all of you. So my name is Ben Breyer. I'm the fellowship director, and I'm primarily at the trauma center here in the city and also at the Parnassus campus.
And I'm Lindsay Hampson. I'm the Associate Fellowship Director, and my focus is primarily on reconstruction and transitional urology. I operate at Parnassus as well as the San Francisco VA. And we have a third team member who's joining us this coming year. Christy Butler was a former resident of ours who just completed her gender-affirming surgery fellowship at OHSU, and we're very excited to be welcoming her back and integrating her into our program.
And we're the core faculty. We're the ones you're going to spend the most time with. But Dr. Jack McInich, who's the sort of one of the founding figures in reconstructive urology, is very much a part of our program. I met with him today. He's here at the county hospital, and so the fellow gets a chance to get mentored by Jack. And also Dr. Lou. Dr. Lou and I. Dr. Lou's a big figure in sexual medicine and does a lot of Peyronie's disease, so you'll spend time in his clinic. Both of them are wonderful, wonderful influences. So here's a map of the city, and you see there's 4 main sites. There's the VA where Dr. Hampson leads the reconstructive unit. There's this UCSF Parnassus campus near Golden Gate Park. There's the Zuckerberg San Francisco General Trauma Center, and then we have our cancer center, which also has a women's hospital and a pediatric hospital. We rotate across all these sites on any given week. The beautiful thing about San Francisco, it's 7 by 7 miles. So getting from site to site is really, really easy. I live by the VA and I actually bike out to Parnassus. It's a 20-minute ride. So it's really easy to get around the city. And this is the Parnassus campus. This is where we do the big surgeries. And most of our reconstructive work that Dr. Hampson and I do, and starting next year, Dr. Butler, is done at this campus. Great facilities, beautiful landscape, a lot of support. You'll have a lot of people helping you during your time here. Dr. Hampson, you want to tell us about Mission Bay?
Yeah, Mission Bay is primarily our cancer center and also has a pediatric hospital. And we do some work at the cancer center when we're helping with combined cases. We often work with colorectal surgery or plastic surgery. And then as part of our transitional work, I also spend some time at Mission Bay doing some pediatrics cases as well. And again, a brand new facility, a great support staff there to help.
This is Zuckerberg. This is really a historic place, and one where you're going to really cut your teeth with the trauma. We go over every single trauma case that comes through as a group. And I think one of the really cool parts about the fellowship is learning how to manage urologic trauma. The other cool thing about it is any kind of reconstructive case that comes through, you get to be the attending on. And so you do a lot of, part of your job is supervising the residents, educating the residents, and that's always super gratifying. I should note, Dr. Hampson did the Seattle fellowship and I actually did the UCSF fellowship. And I can tell you from my experience, having been a fellow here about a decade ago, it's working at the general hospital is super fun.
Yeah, I agree. I think that was one of the really fortunate things about my training was a chance to interact with underserved patient population and also a hospital that specifically caters to, a trauma service. So there's a, general surgery trauma team that's well-versed in trauma and works with us often. And it's really nice to be in that kind of environment.
So, I think UCSF in general is a special place, but UCSF reconstructive urology, I think because of Dr. McAninch, here he is with Dr. Hampson. He's a mentor to both of us and to many in this field. And I think he built a very special thing and something we've tried to carry on for the last decade with our work. So this is give you a flavor of what the schedule looks like. Typically on Mondays we're going to have a busy OR. Tuesdays you're going to spend every third Tuesday with Dr. Hampson in transitional urology clinic and the conference, and the rest of the Tuesdays at the general. Wednesday it's going to be OR with myself or with Dr. Hampson, depending on where the cases are. And in general, you're going to go where the cases are. So Thursdays, you're going to be with Dr. Hampson in the operating room. And on Fridays, you're typically going to be with me. Now, you don't see Dr. Butler on this schedule yet, but as she gets busy doing gender confirming surgery, you're going to go with Dr. Butler. So we've done a lot with how call is run here, and I think it's really been great for the fellowship and for the fellow. When I did the fellowship and we had to walk uphill both ways in the snow. No, I'm kidding. So now it used to be the fellow would take all the call. Now we just have the fellow taking trauma call. And so the fellow gets 2 weekends off a month, in addition to as much, vacation. Typically, I think it's like 4 weeks a year. We also cover, of course, when you're going through job interviews and these kind of things, but it's trauma call only. And I can tell you, having done it, it's enough where you're going to learn how to manage trauma, but it's not so much that it's going to be overwhelming. Typically you're going to get called in to do a case maybe once a week or once every 2 weeks. It's kind of hit or miss, but you're only going to be called in to do a case and to do something interesting.
Yeah, and I second that. I think having taken trauma call during my fellowship too, I think it's a chance to learn how to, manage the residents when they're calling about these trauma cases and help them think through what further evaluation and workup needs to be done. And then being able to be a part of the trauma cases operatively is important. Operative trauma is less and less of, in our purview. And so it's important to be there for those cases because I think you get a lot of learning out of them.
So this is a recent case log. You can see we get a lot of experience with urethroplasty, and we do all the complex urethroplasties in the region, a lot of redo cases. So you're going to come out of here really being comfortable doing that. We also do a lot of prosthetic and incontinence work. I think our penile implant volume is really, really growing. But we do prosthetics and Peroni care. Again, in this genital reconstruction category, we do a lot of buried penis and helping men with their skin problems. But that's gonna, we're excited that the gender confirming surgery is gonna also add to those cases. We do a fair amount of transitional urology surgeries and abdominal surgeries. So I'll do diversions. Dr. Hampson leads the transitional urology program. She does a lot of conduit diversion revisions and de novo cases. And we also do a fair bit of ureteral reconstruction. We don't do a ton of female reconstruction, although I think that that's changing now that Dr. Hampson has a really busy transitional program. And then you can see kind of the numbers of trauma cases of 30. So you can imagine, basically 1 every 2 weeks. And we're also doing robotics. This is an older case log. We're definitely doing more robotic reimplants, robotic bladder necks, and these kind of things.
And the only thing I'd add is just that if people have more of an interest in implants, if they didn't get that experience during residency, we also do them at the VA. And so when you're thinking about, where you want to be on a Wednesday, if it's operating at the VA with me or operating at Parnassus with Dr. Breyer, you can see which cases you think you need more experience with, and that way you can kind of shape your fellowship in the way that you want.
Yeah, I do a lot of checking in with the fellow and kind of gauging, hey, what do you need to learn? What do you want to get out of this week, this month, this quarter of your fellowship? And I think one of the beautiful things is, yeah, you can bounce back between working with myself, working with Dr. Hampson and others.
Just a bit about our transitional urology program. I run this program with Dr. Kopp, who's a pediatric urologist, and we've had this clinic up and running now for about 5 years. We have a monthly clinic. It's the third Tuesday of the month where we start with an hour-long case conference, and that's a chance to present any new or complex patients with transitional urology needs. We serve patients who have all kinds of congenital urologic conditions as they become adults. And about once a month, I have an OR date that's specifically operating on patients from the transitional urology population. And these could be urethral strictures in pediatric patients, redo hypospadias, creating catheterizable channels, bladder augments, ileovesicostomies, and at least once a year, we have a cystectomy for an augment malignancy. So you do really get a broad range of abdominal reconstruction with regards to these cases.
So I think one of the things that sets us apart in arena we excel is our research environment. Just being at a place like UCSF that is emphasizes scholarship and discovery and innovation, you're kind of thrust among people that are really dynamic and thinking about these things. We have a very busy group at any given time. There's between 10 and 15 people in our lab with a lot of statistical support, money to get data, and a lot of ongoing projects that the fellow gets intimately involved in and sort of quarterbacks the group. Here's a picture from our lab meeting, and you see Andy Cohen in the green, who's a former fellow who's at Hopkins now, and just leading on the guy in the red shirt. Next to me is Dr. Patino, who's a urologist, spent a year with us from Columbia. Kirk, who's a med student who spent a year with us. On the other side of Andy is Anthony, our IRB guru and clinical research coordinator, and there's Dr. Butler during her research year spending time in our lab meeting.
And I think from my perspective, I do a lot of NIH-funded research looking at stress incontinence and improving patient decision-making. I also have access to some interesting data sets. The VA data is accessible through Vinci, as well as linking to Medicare data, so that offers opportunities. And we also have a prospective database for our transitional urology clinic that allows fellows to come in and answer various research questions, especially related to quality of life and outcomes. And then Dr. Kopp and I also have access to the statewide California data called OSHPD, and we have full access to the entire California data set. So that also offers a huge data set to answer all kinds of questions, and we're focusing on many of those in transitional urology. Dr. Butler also, as she comes on, will generate her own research interests, and that's something that will be up and running soon.
I'd add, we teach you basically how to run your own program. So there's skill acquisition. So you'll get practice writing papers, doing analysis, designing studies. And, for example, we had our lab meeting today, and you'll see how the data process works and all of these things. But it also inform you on how you can go on to an academic center and run your own practice. We're really hoping to train academic urologists with our program. that's a big emphasis for us. And we think that the person that comes here will, if they're highly, highly motivated in academics, they're going to do really fantastic. So again, we have a big, it's a big network. The lineage is casts a really wide net because of Dr. McAninch, and now all our former fellows. So again, we have a Jack McAninch visiting professor. You work at UCSF, you become part of the UCSF urology family, and really make connections in academic urology that are going to be fruitful for you to allow you to make an impact. This is a picture of Jack and his former fellows. Many of them are distinguished fellowship directors at other institutions, and it's a great great to be here at the seat of where all these terrific people trained. This is just us, having a good time. We have a joke when we see a sort of maybe a problem that we don't really like that much. We say GTs are good times, but there really are a lot of GTs hanging out with the fellow. We form a very, very close bond, and it feels like they're part of the family, and so it's we love the fellows, and it's a great time.
And I would say that, part of being a fellow here means that we're always here for you. So it's very common that Ben or I will get a call from a former fellow asking for advice on a case, or, wanting some help regarding research interests. And that's part of why we're here. That's what we see as our job. So even when you leave here, we will still continue to support and promote you.
Yeah, that's a big thing that is a big part of our job is advocacy. So pushing people along, pushing people forward for committees, pushing people to be involved in collaborations. We see that as a big job and a big duty, and one we really relish to promote our people, especially when they leave, because that's when they really need it. We'll help you get a job, of course, but when you're 5 years out, 10 years out, Dr. Hampson and I are going to be in academic urology for a while, and we're here to support you. So, this is integral to the fellowship, is that we're in this really tremendous city, which is culturally diverse. There's always something going on. It's also geographically diverse. You can go from skiing to surfing to hiking to windsurfing. It's just a lot of, there's a reason that it's a popular place to be. It's just a very beautiful city. It's the middle of February, and it's like 65 degrees and sunny out. So it's a beautiful, beautiful place. I'd also say, if you have a family, it's a great place to be with a family. Both Dr. Hampson and I are parents who live in the city. I'll tell you, because of COVID, it's a great time to be here in terms of the rental market. Much easier to get a place, less competition, and the prices have dropped. It's very easy to get a place close to one of the main campuses. You don't have to have a car. There's a shuttle system. And we've had people that haven't owned cars that have just done Uber. But you can also easily have a car here. And it's a super, if you've never been out here, it's a super fun place to be for like a year as a young person.
And if you do have a family and have kids, there is a UCSF daycare system, and you do get priority in that being a trainee. So that's something we can help you navigate.
And Dr. Hampson and I send our kids there. It's awesome daycare.
Yeah, all our kids have gone there, and we love it.
We're in class together too. So this is, speaking of kids and family, I'm not going to ham it up, but I get a little choked up seeing those pictures because I do really value the friendship and it's a real deep bond. I spend more time with a fellow than with my family. You form a really deep bond with the person, a friendship, and it's a great thing. You'll get that, I think, a lot of places, but we really value the fellow as a person and ensure that it's not a malignant situation. I think as far as fellowships go, it's just tremendous learning, tremendous diversity of really great pathology, where you're going to come out of here with such incredible surgical skills. You're going to come out of here really with a deeper appreciation for research and discovery and how to run a research group. Yeah, we think it's a fantastic program, and we're really excited about bringing you here.
So thanks for checking us out. Be sure to send in your applications. We're excited to interview you and give you a chance to talk with us, and look forward to answering any questions you have.
Thanks, everybody.